The theme this year is End Malaria for Good, and to do that, health workers will need to pay special attention to sub-Saharan Africa. That's where most of the deaths are happening, and most of those dying are children under the age of 5. The decade of scaled-up efforts in the worst affected countries has reduced malaria fatalities, but those programs are expensive to run. CCTV's Katerina Vitazzi explains from Ghana.
Testing for malaria is quick and easy. A small prick on one finger, a little blood is taken, and then put into a testing kit like this one. It's a simple procedure that can save lives. Last year, Ghana had more than 10 million reported cases of malaria. Although fewer people are now dying from the mosquito-borne virus, young children are still disproportionately affected. The team here have already found positive cases.
So far, I think 40 people have been tested, and out of the 40, we have 4 children that have been tested positive. So therefore, the experts have expressed concern in focusing on their children. So we've ordered for more kits to be taken for the children.
Due to public spending cuts, Ghana's overall health budget has been tight over the past few years. There are now fewer government-funded malaria programs like this one. Today's testing is the work of a charity, the JCI. They believe this community was high risk. Fusaine Seidu lives here with her son. She says malaria is common and it's due to the environment.
The sanitation is not good. That's why we get malaria. The environment should be clean, maybe twice a month. The cleaning exercise will go on.
The early symptoms of malaria can include a fever, a headache, or a general sense of weakness in your body. And the disease is so common here in Ghana that many people, if they're feeling those symptoms, won't go to a doctor for diagnosis, but rather go straight to a pharmacist to buy medication for self-treatment. That does lead to many people being incorrectly treated, and clinicians here say that does cause long-term problems for treating malaria.
Diagnosis of malaria is key to the treatment. Now, if you're not diagnosed of having malaria and you go for a medication, what you'll be doing is building resistant strains. Now, if you keep on taking a particular medication for some time, it gets to a time it doesn't work again.
According to the United Nations, malaria kills a child in Africa every minute. This from a disease which is preventable and curable. Katerina Vitazzi, CCTV in Accra, Ghana.